Hi, my name is Dr. Jonathan Howard, and I'm going to be making a series of videos called Things Laptop Class Doctors Said. This series of videos will feature things that doctors who didn't treat COVID patients said. And our first one will begin with Dr. Bhattacharya, who coined the term, as far as I know, laptop class to describe people like himself who experienced the pandemic entirely from their office. But before I do that, let's hear some words from non-laptop class doctors, doctors who actually worked on COVID units. This article, titled Hundreds of Young Americans Have Now Been Killed by the Coronavirus, Data Shows, was published in the Washington Post in April 2020. So COVID's risk to young people was not some great secret at the beginning of the pandemic. This article said, Sean Evans, an attending emergency physician and director of resuscitation at Scripps Memorial Hospital, said he and other doctors on the front lines of the epidemic have been humbled by how many young people have been hospitalized and ended up in the ICU during the outbreak. This is nothing like we had predicted based on the data from these and other countries. Evans, who estimated that roughly half of the COVID-19 patients in his ICU have been under 50, said in an interview. Young people who are otherwise fit can tolerate this longer, but at the expense of their heart and their pulmonary functions, said Evans. He said younger patients he has seen tend to come in later, often battling the disease at home for longer. But for those who take a tragic turn, it often happens quickly. When they do deteriorate, they do so much more dramatically, he said. In those cases, Evans said the lack of oxygen makes the right side of the heart work extra hard, which leads to pulmonary hypertension. The lungs clamp down, they can't get blood flow into the lungs. What has profoundly struck Evans and his colleagues is the seeming randomness of the type of young people who are unable to fight off the disease. A very fit 30-year-old triathlete is just as vulnerable as a chess-playing 45-year-old who gets no exercise, he said. We just don't know who it is that this virus carries the master key to. But he does have a message for any young people still under the impression that COVID-19 is a disease that seriously threatens only the elderly and infirm. Just because they are young doesn't mean they're not vulnerable, he said. Nobody knows what immune protection they have at any given moment. Okay, this was my experience as well. I saw several young people die of COVID, and I saw other people be seriously injured by it. The youngest person I saw die was a healthy 23-year-old in April 2020. So now that we've heard a little bit from doctors who worked on COVID units and experienced this themselves, let's hear what laptop class doctors were telling the public. So Dr. Bhattacharya gave an interview in October 2020 called Seeking Common Ground in the Herd Immunity Debate, in which he said, an infection is a severe problem for older populations and also for people who have certain chronic conditions. For younger populations under 70, it's much milder. And let's listen to Dr. Bhattacharya say that in his own words.
A second premise is that I think everyone will agree that this is an absolutely deadly disease for people who are older and for people who have certain chronic conditions. The infection survival rate from seroprevalence data, now 50 some high quality seroprevalence studies says that there's a 95% survival rate for people who are 70 and older. For people under 70, it's 99.95% survival. It's much less deadly for people who are under 70, 99.95.
Okay, so that's what laptop class doctors were telling the public, as you can see, safe in his Stanford office. What happened after this? Well, 2021 was a bad year for COVID. January 2021, 2 months after this video was recorded, was the deadliest month of the pandemic. Happily, vaccines had just rolled out, but here Dr. Bhattacharya was telling people that COVID was milder for people under age 70. This is an article that was published in January 2021. Again, COVID's risk to young people was no secret. COVID killed thousands of young people the first year of the pandemic. And these are the official stats from the CDC in 2021, showing that COVID was a top killer for basically every age group. And I think it's important to remember that this is what happened, and all of this would have been much worse had people listened to laptop class doctors like Dr. Bhattacharya and decided, hey, I'm under 70, COVID is going to be mild for me. Maybe I don't need the vaccine. In fact, a lot of people probably did listen to him, and they're not alive anymore to tell us about their experience. And again, this is from 2021, 2022, especially January 2022, when the Omicron wave ripped through the population. This was even worse for children. That was the worst month of the pandemic for children. And of course, death is not COVID's only bad outcome, though it is the only bad outcome recognized by laptop class doctors like Dr. J. Bhattacharya. I will be back. I will continue to do a series of these, and hopefully people find them interesting. And remember, when getting health advice, it's always a good idea to talk to doctors who will treat you if you are sick, rather than doctors who spent the entire pandemic making YouTube videos telling you and telling people that COVID was mild for people under age 70. Thanks for listening.